Hello, my name is Lidia Guerrero. I am going to talk about accessibility and reliability of pediatric clinics worldwide. Definition. Current problems. It is not very difficult to reach the conclusion that no hospital center is able to accommodate children in an environment that is in any way warm and familiar to them.
The children's physiotherapy team at the Cromwell Hospital consists of 2 full-time physios who are specially trained in assessing and treating children. We work with children from all ages who might be experiencing musculoskeletal difficulties, anything from a sport injury up until complex orthopedic surgeries. Our main goal as physios is to support our young patients in restoring movement and function so they can reach their full potential. We always begin a patient's physiotherapy journey with a thorough assessment. This is to get a better understanding about the history of the presenting condition. We tend to ask questions to the child and the parent just to get a better understanding of their overall needs and goals. We will include questions about the child's pain, how long the injury has been there for, and also to make sure that their expectations are being met in the session. After the initial assessment, a block of therapy is provided completely personalised to the patient and is done right here at the Cromwell Hospital. To allow for progress and continuity of treatment, a tailored home exercise program is given to each patient. Because we know families get quite busy, we also try and be flexible with our appointment times. Children's physiotherapy is different to adult physiotherapy in a sense that they present with unique injuries due to the fact that their bodies are still growing. So our sessions tend to be a lot more fun and we incorporate play into therapy. This allows children to engage more during treatment and reach their goals quicker. We also like to involve the parents and the siblings to make the support at home better for the kids so they can continue with their home exercises.
Applications in physiotherapy. Within this team, coordination, exchange of knowledge and information is essential. Sometimes the pediatric physiotherapist will simply be a member of the team, while at other times the pediatric physiotherapist may assume the role of key person in the intervention process. Advantage and disadvantage. Advantage. Thanks to child physiotherapy, children achieve their maximum learning capabilities and are able to participate in daily life activities with greater spontaneity. Disadvantage. One of the areas that require physiotherapy, which will be focused on stimulating and facilitating the different stages of motor development. This is a very difficult challenge for parents given the number of different exercises and postures they must remember. Question applied in Ecuador. The professionals of the physical rehabilitation area of the Children's Hospital, Dr. Roberto Gilbert, in the city of Guayaquil, offer the identification and pediatric physical rehabilitation of movement disorders through different programs aimed at the prevention, diagnosis, and treatment of pediatric problems. Conclusion. Our role begins with the diagnosis or prescription of pathologies related to a branch, for which we work together with all areas. Since we observe rehabilitation from neonates to patients in intensive care. Rehabilitation therapy is given according to different techniques of physiotherapy, mechanotherapy, early stimulations, etc.
In-depth understanding of how children and their physical abilities develop. After consultation, we can often determine problems a child faces and suggest ways to correct or manage these. This type of physical management will constantly change as the child gets older. We will often demonstrate and coach parents in how to stretch and strengthen their children's muscles. We also cast and brace limbs to help shorten muscles. They'll actually come down and do the casting at home. They'll drop sheets down on your floor. For us, fortunately, our breakfast bar seems to be the spot where we have the casting done. We bring the bucket, all you have to supply is water and a tap, and then they'll do the casting there and they'll sit till it's dry. Of course, I can't wait there on that cast for a few hours, so it just sort of means to try and do anything. So towards the end of the school day, get her set up some videos and a pillow. Stay in a state of pain, like you don't know if this pressure area is going to be building up under the cast. And we've had one such said, oh, it was hurting, we took it off. And yes, it was making it also. Like I did take it off because then we had to wait for casting to be redone till that healed. So it actually made me pressure sore. And that took 3 weeks to heal. And then we also had the case where someone said, oh, it's dirty. When we took it off, there was nothing wrong. And she just said, oh, it was so hot, I just couldn't watch it anymore. So it's really hard, isn't it? Physios are heavily involved before and after medical and surgical interventions, such as botulinum toxin A treatment or surgery. And we can also individually tailor exercises to help improve the child's strength, maintain their muscle length, and improve movement in their joints. I mean, at the beginning, when she was a baby, I did a lot of leg exercises with her because her leg muscles are probably the tightest. So it's just a matter of loosening, keeping them loose for her. But now I kind of, you kind of incorporate it into your everyday life because you don't have time to sit down for half an hour and do exercises after school because she has all her other stuff that she needs to do. So you kind of put it into her normal life and sort of put things in here and there, and when you're taking her from one position to another, you give her a stretch. She does a set of stretches every morning before she gets ready for school, and got a little bit of a program which we vary that we do in the afternoon depending if she's got swimming. We're not doing it as intensive. It's mainly the stretches and stuff. The other things that we've got, for example, a trampoline, because that's a good exercise that's been recommended to us for her particular problem. For children who stand and walk, we may suggest the provision of special foot splints and walking aids. These are sometimes called orthotic appliances or orthoses. These aids assist in walking by supporting joints. They are also able to assist in avoiding fixed contractions by stretching overactive muscles. In some cases, they may only need to be worn at night. So there are aids that she wears for she gets to choose. She tends to wear long pants and boots to try and cover it so people can't notice. She's clever. She'll wait till she notices have red and you hear something slip flying across the room. She's very careful with it. It's got Velcro on it and on. You can hear it. Or she'll hide it under the pillow. Some children may need wheelchairs or other mobility aids to get around.
and the provision of these can also have a positive impact on the child's social, language and play skills. However, the vast majority of children with cerebral palsy will be able to walk with a fair degree of independence around the home or in the community.
Physio has been arranging her powered wheelchair. That all goes via funding, so they work out what she needs and then that gets put in, and government or